Hi, my name's Helen Wenger. I'm one of the sisters here in the emergency department at the Royal Cornwall Hospitals Trust. We are experiencing, as the country are nationwide, the phenomenon of exit block and crowding. And nationally, according to the Royal College of Emergency Medicine, 500,000 patients are affected by this every year. Crowding is dangerous and we are not accepting it. However, it is something that we are having to deal with on a daily basis. The patient safety checklist is a simple time-based framework of nursing and medical tasks. This is a joint venture between nursing and medical teams. It's prescriptive and it contains all elements of fundamental and basic nursing care. The patient safety checklist makes it very clear as to what needs to be done and what needs to be done next, and it works as an aid memoir to help our staff. So any doctor, nurse, agency nurse that's come down from another ward to help us, as staff have so kindly been doing, we are able to provide this structure for them, and we hope to see some quality improvements. So we hope that it's going to improve our baseline clinical care. We hope we will see less clinical incidents, have more efficient handovers between teams, have a more efficient and robust documentation. We hope that it will decrease our avoidable harms by recognising the patients who might be deteriorating, and we hope that it will improve our communication and team morale within the department and also externally within the hospital.
My name is Rebecca Cairns and I'm a staff nurse here in the emergency department. This is a new initiative that we're rolling out in the emergency department and I'm helping to do that. Today's my first day of actually using it properly. And I've used it 6 times so far this morning. What I've been doing as part of the rapid assessment team is using this section. So within the first hour, assessing the patient, undressing, IV access, bloods, etc, etc. So I think this is going to be a really useful tool in the emergency department to help promote the safety of patients. It's also going to help us to reach our ED targets, for example stroke and the neck of femur pathways. One of my roles in helping to drive this is to be positive and motivate people and explain and educate them as to why it's going to help us care for our patients better.
My name's Anne-Marie and I work in the rapid assessment team. Within Majors 1 and Majors 2, I'm spending a lot of time in the corridor these days due to the numbers of people that come into the department. So anything new that is introduced to try and help our growing department is met with quite a lot of enthusiasm. So this checklist, what it's going to do, it was allow us to fulfill the needs of the patients but also follow guidelines and policies within the hospital about certain things that need to be done to protect patients within certain times.
The checklist was developed by the University Hospitals of Bristol and their key performance indicators show an improvement between 5 and 25% since the implementation of the safety checklist. That's of a number of different KPIs such as stroke performance and our sepsis performance. So we're hoping that we will be able to emulate the same. So far at RCHT we've done a retrospective audit of 240 sets of notes over the last year to get a baseline of where we are with these fundamental elements of care. It shows some good elements as well as some elements that we need to improve on, and these elements are the bits that we hope that the patient safety checklist will assist us in achieving. We're currently on version 2 and I suspect that daily we will be creating newer versions so that it becomes a working document for all of our staff to use and become familiar with and embed fully in the department.